Deficiencies in the enzymes of the mineralocorticoid pathway, such as 21-hydroxylase, lead to impaired aldosterone synthesis, resulting in renal salt wasting, which manifests as hyponatremia, hyperkalemia, metabolic acidosis, hypovolemia, and hypotension, a potentially life-threatening condition known as a salt-wasting crisis that often presents in neonates with poor feeding, vomiting, weight loss, and failure to thrive. A blockage in the pathway at the level of 11-beta-hydroxylase, a cytochrome P450 enzyme encoded by the gene CYP11B1, prevents the conversion of 11-deoxycorticosterone to corticosterone, leading to a buildup of 11-deoxycorticosterone, which is a potent mineralocorticoid that can cause fluid retention, hypertension, and hypokalemia, although this mineralocorticoid excess effect may be less severe than in other forms of congenital adrenal hyperplasia due to the lack of sodium retention. Within the zona fasciculata, the largest layer of the adrenal cortex that is primarily under the regulation of adrenocorticotropic hormone and expresses 17-alpha-hydroxylase and 11-beta-hydroxylase, but not aldosterone synthase, the glucocorticoid cortisol is the predominant product. Pregnenolone can be directly converted by 3-beta-hydroxysteroid dehydrogenase to progesterone, which is then hydroxylated by 21-hydroxylase to form 11-deoxycorticosterone, or alternatively, and more commonly, pregnenolone can be hydroxylated by 17-alpha-hydroxylase to 17th-hydroxypregnenolone. Similarly, progesterone is converted by 17-alpha-hydroxylase to 17th-hydroxyprogesterone. Both 17th-hydroxypregnenolone and 17th-hydroxyprogesterone are then acted upon by 21-hydroxylase to form 11-deoxycortisol, which is a potent glucocorticoid precursor that is then hydroxylated by 11-beta-hydroxylase to form cortisol. Cortisol, the primary glucocorticoid, is essential for maintaining life by mediating the stress response, stimulating gluconeogenesis, glycogen synthesis, and protein catabolism, inhibiting insulin secretion and muscle glucose uptake, suppressing inflammatory and immune responses, and maintaining vascular tone and responsiveness to catecholamines, and its deficiency, as seen in most forms of congenital adrenal hyperplasia, leads to adrenal crisis with symptoms of hypoglycemia, hypotension, fatigue, and weakness. A blockage in the pathway at the level of 3-beta-hydroxysteroid dehydrogenase type 2, an enzyme that converts delta-5 steroids to delta-4 steroids and is also essential for sex steroid synthesis in the gonads, results in a generalized decrease in glucocorticoid, mineralocorticoid, and androgens, leading to a condition characterized by salt wasting, ambiguous genitalia in males due to insufficient testosterone production, and virilization in females due to peripheral conversion of high levels of the weak androgen dehydroepiandrosterone. Within the zona reticularis, adrenal androgens are produced,